The program displayed in this video is not meant to replace your doctor. We have tried to provide an as high as possible diagnostic accuracy. Nevertheless, when in doubt, always consult your physician.
Random spots or suspicious moles on your skin? Should you worry about it? We often ignore spots, moles, or birthmarks on our skin because consulting a doctor for every irregularity will be time-consuming and unnecessary. Melanoma is one of the rarest and yet most aggressive and therapy-resistant types of skin cancer. Nevertheless, cases of melanoma have become more frequent over the past years. Early detection is critical for a higher chance of preventing metastases and eventually death.
For diagnosis of melanoma, the ABCDE method is developed and used by dermatologists to analyze a suspicious skin lesion. This method is based on 5 features of melanoma. First, there is asymmetry of the spot. When drawing 2 perpendicular lines through the center of a spot and comparing how much 2 halves correspond with one another, a percentage of symmetry is found. Risk for melanoma increases as symmetry decreases. Secondly, there is border irregularity. The border of a spot can grow in circumference while keeping the same area. The relation between circumference and area is used to determine compactness, which tells something about the roundness of a shape. A lower compactness means increased risk of melanoma. Thirdly, there is color variety. The amount of colors in a spot is a good indicator of how much melanoma has spread in the skin. These colors are white, black, blue-gray, red, light brown, and dark brown. By counting the amount of colors present in a spot, an indicator for the severity is acquired. Next up is diameter. Bigger spots are often an indication of melanoma. Although melanoma starts off small and relatively harmless, they become more dangerous when the spot grows and spreads. A general rule of thumb is that when a spot is larger than 6 mm in diameter, it has become more dangerous for the patient. Lastly, there is evolution. Although spots can start small, melanoma and other types of skin cancer grow as they persist. This growth may not be detectable on a photo, but it is part of the ABCDE method nonetheless. This is usually trustworthy and will give relatively accurate results, but because every human tends to see things differently, it can be very subjective, which can result in false or inaccurate diagnosis, especially when not done by a professional physician.
The program is engineered to exceed human diagnostic accuracy. By comparing an image with its mirrored version and calculating pixel overlap, an objective way of measuring symmetry is obtained. Our second feature, border irregularity, is measured by compactness, which is a way of measuring roundness of a shape. Lastly, color variety is measured by identifying significant presence of 6 different colors frequently seen in melanoma spots.
These 3 features are then combined into a final score which gives an indication for melanoma probability. Depending on this score, it will advise the user if it is necessary to visit their physician.
As we mentioned, this program is engineered to exceed diagnostic accuracy. The goal we want to reach with this program is to provide an objective and clinically accurate way to measure a suspicious spot. Therefore, we have implemented 3 features, namely symmetry, color variety, and border irregularity, from the ABCDE rule used by dermatologists in the program. Like we said, these 3 features will then be combined into a final score. With this final score and advice given by the program, we hope that this tool will be helpful when diagnosing melanoma. This program is far from perfect, but it is the start of a new alternative to diagnose melanoma accurately.